welcome viewers to Health Matters. Thank you for joining us in the Rogers Community Television studio. My name is Teresa Fraser. I'm a registered psychotherapist and child and play therapist, and I have a few other things up my sleeve going on in my world, but it's my pleasure to have Nadine Robitaille here in the studio. She is a director of Carry On Therapeutic Services. I got that right? And before the break, we were talking about signs and symptoms of that families and adolescents might also recognize in themselves when they're experiencing anxiety and depression, as well as normalizing that we all feel anxious and we all feel sad at times, but recognizing at what point maybe additional intervention might be valuable. So Nadine is going to talk with us about play therapy, because many people don't associate play therapy with adolescents or adults or families. But also, I know you do this because we've talked about it when we've done case consultation, that in addition to interventions for adolescents, we're also looking at things like, are they getting good exercise? Absolutely. Are they eating? What's their sleep hygiene like?
Sleep is huge.
That's a huge one.
Huge.
And I know as a parent I struggle with that. The best thing my husband did was put in a modem that we could, first of all, we know where they are, where they're going, where they're visiting when they're traveling online in the virtual world, and one that we can just pull at a certain time at night, because otherwise the temptation to stay up all night and mix up your sleep cycles is really big, especially if you have kids who, I find with kids who have anxiety and depression, it's much easier to deal with the virtual world than the real world. So though it can also be a strength to have your child have friends in the States or in other different time zones, and it's so easy to do that now in our current world. Very common that kids will play with video games with people from all over the world, but it can also predispose kids struggling in terms of day-to-day functioning, but also how they're managing feelings. So would there be anything else? I know I do diet and sleep and hygiene, but I also look at resiliency factors like who are the people that support you, who can you go to? And also, if I'm only seeing a teenager, once a week, as you do, then who are the people you can go to in between sessions, and who can you call, whether it's a children's helpline or if the college students, if you're a college student, there's also a college student helpline, and we'll hear more about that in a future show when we have representatives from student services at Sheridan College talking about resources for mental health for college students. But if, so many people don't, you're also the president of the Canadian Association for Child Play Therapy, so I didn't say that. So I would say as a member, thank you for your service. But what would, if a teenager comes into a play therapy room, you talk to Nadine about art-based interventions and music and makeup or games, what would I find in a play therapy room as a parent? I bring my child, we meet, I drop them off, I pick them up, I go, if it's a little person, I go, how did it go? Oh, we played.
Yes.
It was fun.
It was fun.
And I'm thinking, really? You played?
Yes.
Are we getting towards any issues? And my teenager, how did it go? Fine.
Yes.
Did you talk about things? Yes.
Yeah.
Alrighty.
Or I don't remember.
Or I don't remember. Or I don't want to talk about it, which is all normative responses from an adolescent. But what would we find in your room?
So we have different sections that are set up. So we sort of have an art section that will have, paints and pastels and crayons and markers and glue. We have a sand tray section with miniatures of all sorts of.
And I know what you mean, because that's a modality I love.
That is your modality.
It's my modality. But what would our viewers at home? What would that mean to them?
So oftentimes sand tray will ask children oftentimes to create worlds that will help to be able to see sort of how they view their world, the people in their world. They'll often use different symbols. Which just helps us to be able to gain some insight.
So it's like miniature toys.
Exactly. And again, that's sensory for them. It's so interesting to have the adolescents specifically come in and they'll say, this is a baby room, I don't want to play in here, or I don't play with sand. And next thing you know, they're sort of moving over and their hand is moving through the sand. And even just that for them sometimes will allow them to be able to start to explore and discuss their feelings. And asking them sort of, what would your world look like if you were to create that in this sand tray? And it's quite telling what their world looked like and the different figures that they choose. And and what that represents for them.
And really a narrative story
Absolutely.
with toys.
Absolutely.
Yeah.
There's puppets, which surprisingly enough, many adolescents may struggle with being able to directly communicate, this is how I'm feeling, but to do so third party through puppetry is quite interesting. And again, the typical response is, I don't play with puppets, I'm a big girl or I'm a big boy. Yeah. And it's just that natural pull and that natural gravitation for them.
I had one adolescent once say, he said, I don't do that, that's for babies. And I said, well, you know, I've had other kids your age and even older, you know, use puppets. And I go, can anybody see? Nope, no one can see.
Absolutely.
And then they're like, okay, well, whatever, I'll do that for you.
Yeah. Exactly. It's also very helpful if I'm doing parent-child, because there's something a little less threatening about the puppets speaking with each other as opposed to mom communicating to child and child.
So you brought up a really great another piece that sometimes we don't necessarily see adolescents on their own. The parents can come in. And even if the conflict is, say, if there's sibling conflict,
that's right,
siblings can come in.
For sure.
And I know you also do some other important work that we haven't touched on that is really amazing. Can you talk about your mediation stuff?
Yes. The mediation work is bringing families together to be able to sort through, outside of the court system, the conflicts that are going on. And really looking at building and widening that circle for children and for families to be able to, who's going to provide the support? What's the action plan? What's the game plan going to be? How are we going to resolve conflict so that we can be a healthy unit, whatever that unit happens to look like? And you know, specifically when we're dealing with kids with anxiety and depression, adolescents are difficult to parent. Anyways,
yeah.
Regardless.
My husband calls them the surviving years.
Absolutely.
Got to survive
every gray hair and wrinkle. It's got an adolescent child written all over it, right? I mean, it's a wonderful stage, but it's definitely challenging. And when you add in mental health issues to go on top of that, and you know the significance of families with issues in terms of separation, divorce, all of those, you know, blended families, life becomes really complicated.
Yeah, it absolutely does.
And the mediation work is, again, just a way of how do we widen that circle, make the focus on the child, because at the end of the day, irrespective of all of the things that are going on as adults, the end goal for that child is always when we want the child to be happy and healthy and loved. And so how do we pull that big circle together to be able to support that child?
That's such a beautiful point that you make, because with families that are struggling with the transition of, you know, we were together as a couple and maybe emotionally we haven't been for a long time, and now we're going to formalize that and, you know, be in separate places. If you can get parents to the point of going, okay, but at one point you were on the same page around this child or teenager as your priority, and you shared some vision on what you wanted for them and your family.
Yeah, and we see some beautiful things happen in that work. We call it just the magic of that process, and the belief that if we give families opportunity to be able to come together in a safe place, they can they have the ability to solve their own
well, in mediation, just using the word mediation versus, you know, being involved in the legal system, mediation is collaborating together versus kind of being stuck.
Absolutely.
And adversarial, I guess, would be the word I would use.
And for our young people, what we see is look at all these people that have come together who love and care about you.
Who can put their stuff aside and help you.
Exactly.
Wow.
And at the end of the day, they walk away with a clear plan of how they're going to move forward in managing whatever challenges that particular family's having.
So if I'm, as our viewers, so I'm a viewer and my adolescent is, I'm really kind of concerned with the symptoms I'm seeing, and I don't have an employee assistance plan, and I don't really have money right now for therapy, because it isn't free. It's a service. I can go to my family doctor.
Absolutely.
And my worry of going to the family doctor is we're just going to look at medication, and if I'm if my child's, you know, abusing substances, I may be kind of concerned about, oh, you know, are we just substituting one thing for another thing? And maybe, but the doctor might say, yes, but we're regulating this, we're supervising it, we're watching it really closely, so maybe if we look at meds, you know, you're going to see less substance abuse. But aside from that piece, in the Peel region, where could families look for services that are funded by either the community or the government?
Sure. So Canadian Mental Health Association
Right.
is wonderful program that offers both for the child but also for families
Right.
that are struggling. Because sometimes with adolescents they're very resistant to seek treatment. And we are a real firm believer that if the child is really resistant, it doesn't mean that their circle of support can't gain understanding and insight in
Right.
terms of how to help.
So I could get support for myself and how I
absolutely.
could parent maybe in a different way or
Absolutely.
a more effective way to manage
Absolutely.
what we're seeing at home.
And helping the school to understand, right, and teachers to be able to understand, again, building that circle of support for the
Right.
child, so that even though they may be resistant to acknowledging and seeking assistance, if everybody in their circle
Right.
has an understanding and is intervening and responding in a way that's helpful, that in and of itself is therapeutic for the child.
Which really circles back to a previous show that we talked about at the beginning of this show around the circle of courage and looking
Absolutely.
at, where do kids belong? And it isn't just
Absolutely.
at home, it can be in their school environment, in their recreational environment. The other thought I had as we were talking was every community in Ontario has a lead mental health agency,
Yes.
and in our community it is Peel Children's Centre.
That's correct.
And I believe they still have, last I checked, they had Tangerine Counseling, which is drop-in.
That's right.
So
Yep.
I'll invite the viewers, we'll get that across the screen before we end our segment today with the contact information for Peel Children's Centre and Tangerine Counseling. I could just show up with my child and say,
Absolutely.
we're really struggling, can you help us here? And they may not be able, they may put us on a waiting list to get some additional support, or they may give us an appointment pretty quickly, or say, maybe this is a clinician that can be supportive, or have you gone back to your family doctor? So there's those options.
Absolutely.
And then online, if I wanted to find a play therapist, and I'm a big believer in play therapy, as a play therapist, I could go to the Canadian Association for Child and Play Therapy,
That's correct.
click in the community that I live in, and the names of all the certified therapists would pop up. So, and in your practice, you, before we close, we have about 15 seconds, you have an office in Brampton, and then you also provide service in Barrie.
That's correct.
Awesome.
Yeah.
And if you get a referral and you can't take that child, I'm assuming because you're the president of the Canadian Association of Play Therapy, you have a network of
Absolutely.
other therapists.
Yes.
Okay.
And services in other communities.
In other communities.
Yeah.
Well, I can't thank you enough for
Thank
taking
you.
time to join us today and helping our viewers learn a little bit more about how to support the adolescents in our community and in their own families. And it was just lovely to see you.
You too.
So
Thanks,
take
Teresa.
care.